So a friend of mine texted me this morning, a former football player. He played for Rice and then played a little bit for the Minnesota Vikings at cornerback. He said that he is having pain in his popliteus muscle. So even though he's retired from football, still very active and trains clients. And so I'm trying to give you, GA, a few ideas that you can do to help relieve your symptoms and get past this injury. So first of all, if you have a lacrosse ball, it's really nice because it's firm. You can put that lacrosse ball down. Now the popliteus starts at the lateral epicondyle of the femur, and then it runs down and in, and it kind of fans out towards the back side of the tibia. And that's kind of the path of that muscle. So if you can kind of go along that path and just kind of get that pressure on the muscle, that's good. If you find a really sore area, you might sit on it and see if you can relax down and just kind of get a release out of it. If you have any numbness or tingling or anything like that, try to get off that area because there are some neural structures back there. But that's a good one. Another one is you can jam this ball up in your knee pit or popliteal fossa, put pressure on it here into flexion, and then just rotate the tibia in and out. So the main function of the popliteus muscle is to rotate the tibia in. It unlocks the knee. We think of the knee as a hinge joint, but it actually has some rotation at the tibia. So the popliteus muscle does that internal rotation when the knee is flexed, and it also can aid in flexion of the knee. So to work that muscle, the best exercise is to use some bands, some TheraBand. If you don't have some, you can order some online or just visit your neighborhood physical therapist. We love these. But what you can do is you can do the exact action of that muscle to strengthen the muscle. So I'm going to put it right here on the inside of my foot. So on the other end of this, I have it in a door with a knot to hold it in place. But what you want to do is take it and turn your foot in as you bend your knee and let your tibia and foot kind of drift inward. So what it's doing is it's working that internal rotation at the tibia, the flexion of the knee, and it's also working the hip external rotators, which is really important for alignment with all this. So again, you just kind of tap the ball of your foot down, and then you go in and across, and then back real slow, keeping the tension on and working that popliteus muscle. Reps on this, I would just go to fatigue. You know, you want to work the muscle, so try to fatigue it, maybe get a couple sets of those in. That's probably the best exercise, but there's some other good ones that can focus on the external rotators of the hip that's important. So you can get the band where it's pulling your knee in, and you want to fight that. So this is kind of here to make it difficult. And then you could hold maybe a 30-pound kettlebell or a dumbbell and just go into a lunge, touch the knee, make sure all the weights, most of the weight, 80%, is driving through that heel of your front leg, but making sure at the same time that the knee never collapses in. So just kind of working through that exercise. Again, go to fatigue, certain number. If you go to a number, you're probably not getting to fatigue, so just wear it out. And then this one, we can add a proprioceptive exercise. This is a balance exercise that also works on controlling, making that knee make sure that knee doesn't fall in or collapse in. So you can go down, touch the floor, come back up, make sure the knee doesn't collapse in. See if you can do 10 of those. So you can work through those a little bit. And one more massage technique, if you don't have a ball, is you can just get in there with your fingers, or you can cross and get in there with your thumb and do little clockwise circles, counterclockwise circles. And again, you can just get in there and dig and really get on that area where there's the most pain upon pressure, and just sit on it for maybe a minute or two and see if it'll release. So if you don't have the lacrosse ball, you can do that. So GA, hope that helps, and hopefully I'll see you next